I just wanted to share with you a study published in the Journal of Clinical Lipidology. And the study is really cool because they actually conclude that measuring a person's omega-3 index gives a more accurate prediction of heart disease risk than the standard risk calculator that doctors are currently using. And they go on to say that this should be considered for inclusion in standard clinical risk assessments. So what is this pooled cohort equation? Well, doctors normally estimate heart disease risk using a formula called the Pooled Cohort Equation. And this formula looks at factors like age, blood pressure, cholesterol levels, smoking, diabetes. But this study found that when you add the omega-3 index, it improves the ability to predict who is actually at risk. So the omega-3 index is measuring the percentage of omega-3 fats, such as your EPA and your DHA, in red blood cell membranes. And it's reflecting how much omega-3 has actually been absorbed into your body, not just how much someone reports eating. So what the study is showing in practical terms is that people with a higher omega-3 index had lower cardiovascular risk, and people with omega-3 index levels that were lower had a higher cardiovascular risk. So this is really important because this measurement improved prediction beyond the traditional risk factors. So why does this matter clinically? Well, you can have two people with identical cholesterol, identical age, identical blood pressure, but very different omega-3 index levels. And the person with the omega-3 index that is lower has an actual cardiovascular risk that's higher, and this could be missed. So this is so important because it can reveal a cardiovascular risk that's not explained by cholesterol, blood pressure, smoking, and this points to inflammation, membrane structure, and heart rhythm regulation. So there were several patients who came to me a while ago and said, what is this information that we hear about, like heart arrhythmias and omega-3 fatty acids? So just remember, omega-3 testing is not just a nice to know index. It's just not like a great blood test to run if you have nothing better to do. It has the ability to predict heart disease risk beyond those traditional markers of cholesterol and blood pressure. So if you do not know your omega-3 number, your omega-3 index, and your omega-6 to 3 ratio, what's stopping you?